Welcome to the business edition of PM Express, and today we're talking about medical research and vaccine development and what role can the private sector play. You know, the coronavirus continues to cause havoc to our economies, as I've said, but at the cornerstone of this challenge has to do with how we also building the medical sector and even developing the right vaccines to fight these challenges. And what role can the private sector play? Well, today I have a special person in studio. He is Professor Alex Dodu, he's Director General of the Ghana Standard Board, but also a clinical pharmacologist. He'll be telling me what that means in terms of drug development and all those things. And so he's not here as a Ghana Standard Board person, but his understanding and deeper appreciation and workings on several boards when it comes to development of medicines and all those things. And also, we're speaking to those who go into the research of it. And what about the private sector as well? Do they now see the need to partner more with the medical sector? This is the business edition of PM Express. My name is George Jaffe. Take a short break and we'll be right back. Welcome back to the business edition of PM Express, and we're talking about medical research, vaccines. And I know that's something that the business community often shy away from. But in the wake of this coronavirus, it has become something very, very important. We've come to understand that, talk about the economy, talk about businesses, it's all about the human beings. You can grow an economy, but where are the human beings to ride or grow that economy for you? And that is why it's become critical for us to look at the contribution of the private sector when it comes to developing vaccines and also medical research on the business edition of PM Express. We're joined also via Skype, Sonia Hosi. He is the Chief Executive of the Chamber of Bulk Distributors, but he is actually leading a private sector group that is actually trying to help with this whole COVID-19 issue. What do they want in terms of the private sector when it comes to that close collaboration between the medical field in terms of research and vaccines development? And also Professor Alex Dodu, he's the Director General of Ghana Standard Board, but he's not here in that capacity, even though we'll also find out from him. But also the fact that he's a clinical pharmacologist when it comes to drugs. But I won't be talking much on that one. Prof, thank you so much for having time for us this evening.
Thank you, George.
I knew your role first as a clinical pharmacologist. What does that mean?
Clinical means things to do with human beings who are ill. Pharmacologist means
those who are ill. So if I'm fit, I don't need your attention.
Well,
preventing health.
Healthcare includes making people happy. So human beings really is the clinic, and then the pharmacology has to do with medicines or drugs, as we used to call them in the past. So people who are just pharmacologists will just deal with the effects of medicines on people, on animals. But clinical pharmacologists, our specialty is human beings and medicines and how it makes them happy or less ill. And that includes vaccines, medical devices, and anything else to do with human beings and medical interventions.
In economy, when it comes to finance, when it comes to economics, maybe that might be my area. We project, we extrapolate. We even know that for the next 5 years, this is how the economy is going to grow. Does it come across that the medical fraternity, the pharmacology fraternity, and you work with WHO, you work with several developed economies and several boards, were you taken up by surprise in terms of this whole COVID-19 thing?
I personally was not, because we know that coronaviruses, of which there are so many different types. In fact, if you start counting, I think currently there are about 16 different types. And they move from the northern hemisphere, as in Europe and co, to the southern, Australia, New Zealand, and they are seasonal. And indeed, Noguchi has always had a sentinel surveillance site for, we call it pandemic influenza. We have been expecting it. Indeed, last year, 2019 May, we had a meeting in the UK looking at the science of vaccine safety, and our concern was simple. What are the next pandemics, and what vaccines do we need to start looking out for the next pandemics? Did we expect it to be this devastating? The answer is no. It's taken us by surprise just because we all probably should have known better.
There's this saying, I hope I got it correct, that when you fail to plan, you then are bound to fail.
Exactly.
Does it mean that everybody went to sleep, including your community?
I think you can say yes. You can say yes for one reason. 100 years ago, 1918, we had a Spanish influenza. The estimates varied, but it killed between 10 to 40% of the world's population at the time. 67, 68, you had the avian influenza. It killed 1 to 5 million. Then we had SARS. Then we had the H1N1. So these events have been cyclical, and to the extent that we went to bed. But there is a reason for it. We all got too happy. Countries were just relying on prosperity. We started putting our defense in, I would say, armory rather than in medical science. And we forgot what kept us safe. Indeed, from the early 70s, when we had the discussion at Alma Ata, let's get rid of polio, it led to a rapid eradication of what we call communicable diseases, as in diseases that talk to each other, I mean that human beings can give one to another through the air or other means. The moment we thought, oh, we are in charge, Shakespeare comes to mind, because Shakespeare says that security is mortal's chiefest enemy. The moment you think you have security, you have no security. What has this exposed? I think at the Ebola time in Ghana, we made that comment, Noguchi made, I did, that if we don't prepare for Ebola as if it's a pandemic hitting us, the next pandemic will floor us. We stated that categorically, unequivocally. I stated it, Noguchi said it, maybe the style or the manner of saying it wasn't good and led us into trouble, but that is history. But the fact of the matter was that if we don't prepare for our security, because during the Ebola crisis, if it had happened in Ghana, we were lost. So the question to ask is that, okay, we saw Ebola. What did we put in place to be sure that when the next Ebola, and now COVID is worse than Ebola, when it hits? Because Ebola, we saw Liberia closing down, Sierra Leone closing down, Guinea closing down for almost a year. We saw their economies decimated. We saw people from Europe and America going to Liberia and Sierra Leone trying any medicine, chloroquine, hydroxychloroquine, any medicine. Is it different from what's happening?
I'll be coming to you on the various medicines that people are putting forward to and all the rest, but also we shouldn't forget that we're looking at how can we bring the private sector on board, private businesses on board in terms of medical research and development of vaccines. But I have Dr. Patrick Aboagye. He's the Director General of the Ghana Health Service on the line. And thank you, Doc, because you oversee all these things, and I'm trying to find out from you, what are you doing to ensure that if the support from government doesn't come in on time, how are you positioning yourself to ensure that you bring on board the private sector to improve medical research and develop vaccines in the country? Doc, thank you so much for joining us on the business edition of PM Express.
Thank you very much, and thanks for inviting me to join this conversation.
So, Doc, sorry, go ahead.
We have always worked and plan to work with the private sector, because our business to get all resources and that we can get in order for us to provide good health and provide access to health care. Corona brings in this week new challenges.
Sorry, it looks like we're losing Doc. If you can position yourself well, it would be great. For that is the Director General of the Ghana Health Service, Dr. Patrick Aboagye, telling us what they are doing in terms of bringing in the private sector. Whilst we work with the line to get Doctor back, can we get Senyo Hosi? He's Chief Executive of the Bulk Distribution Company. But bringing Senyo on board because he's part of a group of chief executives and the private sector that are actually taking some initiatives to support the deal with the fight against the COVID-19. Senor, thank you so much for your time, and I appreciate it so much. So the private sector, are things going to change in terms of showing more interest into issues of medical research and also developing local vaccines?
Good evening. I'm George. Good evening to you all. I think COVID has really been an awakening event for most of us. One of the things that private sector has to realize is that we account for 80%, about 80% of the country's GDP. So in cases like this, in times like this, we tend to suffer the most. We account for the larger share of employees. We have to account for them and take care of them. And now, with all that's happening, nobody can run and go anywhere. We are all as even as the world, globally. So it's quite a call on us to take a lot more serious look at our entire governance policy sphere. We can't be passive about policy anymore, because when it fails, we suffer the most for it. And it's for that reason that, together with some like-minded private sector players, we have embarked on a journey to set up the Ghana COVID-19 Private Sector Fund to support government intervention, rather deliver a more swift response to the sufferings that's related to the entire COVID-19 attack on our humanity.
But Senor, do I get from you that this will just be the beginning, but it won't be the end? After COVID-19 is over, you and your colleague CEOs will go to sleep and focus on the bottom line.
I don't think we can go to sleep. We are not looking at short-term interventions for now. Tomorrow, God willing, we should be cutting salt. The president will be cutting the salt for one of our major projects, to be the development of Ghana's first ever infectious disease isolation and treatment facility at the Kerens National COVID-19 Treatment Center. We have none like that, and we need this. But we are bogged down often with just looking at our numbers. Now we realize that we don't play a more active role within the entire policy sphere, and things go so bad, we cannot be exogenous to that occurrence. It is a key part of our ability to thrive in the future. So it's not just a one-off. We would have to pay critical attention, not necessarily as a fund, but as business persons, in the general activity and nuances of public policy. You can't just leave it up to Prof and his colleagues to get things done. It behoves on us also check to see, are you getting things done the way you should? Are you protecting us enough so that we can really focus well on our businesses? We need to take a lot more interest within that space.
Senor,
and just for the record, something like the current facility we are looking at, which we hope to replicate in Kumasi, Tamale, and Western region, subject to funding that we'll get from the general public and other corporates as well. We're also looking at the sustainability of the facilities. We do not want these facilities to be run down like we often find most government facilities turning into. A beautiful facility when it's set up, but as my friend says, we have a deliberate design in our country, never to develop anything to maintain. We create and develop things to destroy them. That is not sustainable. So we are actually looking at another fund to maintain the facilities beyond the construction and development of it. So we have a long-term, some of the interventions that we are embarking on.
Senor, apart from initiatives like these, when you engage your colleague CEOs who are doing these things, what do they want when it comes to getting the vaccines done locally, a more local-oriented vaccine, you know, tropical vaccines, and even tropical research into some of these things?
One, we need to realize private sector is the biggest taxpayer, and you are part of the private sector. So the key thing we really ask ourselves in these steps is how efficiently and effectively our contributions to the state kitty being used. That's the key question you really want to ask. And there are questions that will keep asking a lot more and will rather be demanding a lot more performance on the part of state actors. Some of us also state actors in some form, and I think it's also a call on us to really get a bit more focus to deliver the fiduciary responsibility that the state and its people have entrusted on us. So yes, vaccines should be there. What is government doing about it? Are we prioritizing right as a country? What exactly is the focus? I think that this has made us realize that we need to prioritize things well and also cut out the waste in our general governance system. Is it possible for us to do things much cheaper than we currently do? For those private sector players who go out there and try to take advantage of every government contract. We doubled them, overcharged them. Now it's also an awakening call on you. Just think about it. That money could have been invested in the vaccine development. That could have been invested in an isolation facility. Today, no matter how much money you have, you can't be flying to the UK. You can't be flying to the US. You can't go to Nyaho. Nyaho will not take COVID. Lister will not take COVID.
Okay.
Iraq will not take COVID. So you must think of how the country as a whole is sustainable for everyone and not just your parochial interest. And that is a posture we are building as private sector.
So you hold on. I'll get back to you. I'll get back to you on the sustainability of some of these things in a more closer collaboration within your end, and the universities. I mean, some other countries, they have chairs, they have research centers and all the rest. Maybe moving on, this is something that you'll be going into. But just hold on, I'll be getting to Prophet in studio with me. Are you, I mean, moving away from your place at Standard Boards and putting yourself in the medical community, are you excited by some of these things? Or listen, just like Oliver Twist, the private businesses can do more. Looking at what happens in the US, the Johns Hopkins and the others, and what they are doing for us to develop vaccines for these things.
Okay, George, there's a German word which calls Schadenfreude, which is basically someone being happy at the misfortune of others. In Ghana we say, oh, semikanye. I mean, I'm not going to say that, but the issues have been this. These issues have been there since independence. We have failed as a nation to confront them. Basically, I have made for the past 20 years at least 10 times, maybe 30 times, that a country's security rests on itself. We have been, buying and selling. We fail to realize that in times of crisis, we are on our own. And this COVID-19 crisis, if we needed any reminder, case in point, India has banned the export of antibiotics, paracetamol, and the likes, including the raw materials to make them. China, same. The UK says you cannot export parallelly things you import to go to developing countries. What does that tell us? We're on our own. Most of the Russian, former Eastern European bloc, the states have banned the export of food. So for us in Ghana, this is the time, and I'm very happy that His Excellency the President stated that the time for self-sufficiency and building domestic capacity is now. Now let's come to the private sector. I have been president of the Pharmaceutical Society of Ghana for 2 terms. 2 terms, I couldn't extend it any further. And during that time, what we noticed that we were short-term businessmen in the pharmaceutical sector. We just want to make our profits and move on. Government has been good, successive governments. We've gotten waivers upon waivers from the 80s. But still, and the pharma sector has developed. Are we anywhere near there? The answer is no. Investments in production, especially in the pharmaceutical sector, they only yield fruits after 5 years or more.
And Prof, that's what I just want to come in, just a quick education here. Some have said that the medical fraternity, the research, the vaccines, they are too rigid when it comes to the protocols. Can you just walk us through in trying to develop a vaccine? What do you have to go through? And is it more of a futuristic or a forecasting, or it has to happen before I develop a vaccine? Just vaccine development 101, as short as you can.
Okay, vaccine development 101. First and foremost, you need a regulatory framework. You are going to try something on human beings. Fortunately, in Ghana now, we have a very strong Food and Drugs Authority. No doubt about that. The leadership, they serve on so many vaccine committees. They help with Ebola. So that aside. Now, what does it take from the private sector side? What we need to do is to realize that if you want to produce vaccines now and you start this year, you will not succeed in 2020. Forget it.
Are you giving us the fact that those of us who are so excited that COVID-19 vaccine could be ready in September or even December, we should forget?
There'll be some, but not developed from Ghana. None developed from Ghana. Maybe trialed in Ghanaians, but the development started long ago. Because we just don't have the capacity. We have expressed the desire. 2 years ago, the president signed with Merck, the German company, and some private sectors in Ghana to get involved in vaccine production. So now when you start, don't wait for profits now. But when the profits come, they are so big and so long term. You're a figures person. In 2013, the size of the global pharmaceutical market was 7.8 trillions, trillions. in the next 10 years, 2030, is going to be 18 to 19 trillions. I mean, I hope trillions. So it's big business. Of course, with big business, they need to be cared to look after human beings. But that's why I said we now have the Ghana Health Service as a world-class ethical committee. We have a world-class Food and Drugs Authority, without doubt. I mean, they have been said, they helped develop Ebola vaccine. So Ghana is almost there, but the private sector has not been wooed, and I do not expect.
Why is that a big deal? Is it because we see these things that it is not closer to me, so I don't care? It has to hit us before we act.
There are two ways. One is that government would have to put money to do the dirty job. Once government is done, private sector comes in when they can see the end of the game. And that is where we have to get to now. But we all went to bed on basic research. I mean, most of us who are professors realize that, look, if I can work for Gates or do a project for Gates or WHO and get my
more money.
No, make some money, because here
money,
you knock at the door and you face stress. Having said that, there's no Ghanaian in my age group who has an excuse if we don't serve. Because we went to school for free, we went to school to have fun. So there's no excuse. We have to serve and we have to develop. We need a private sector, but most of our scientists are terrible businessmen. And we are bad communicators. We don't tell the private sector that if you put in 100 million now, you will not get your treasury bills money, but when the money comes, it will rain on you.
But where do we change the line? What do we do? You've been there before. You are being private sector, you move to regulatory. Maybe people like you can take the initiative, letting our scientists from the medical school guys and all the rest coming to appreciate that, listen, this is an area that you would not lose if you invest. So listen, get somebody like Senior Jose on board, convince them to invest in medical research, invest in vaccine development, and listen, the returns might even be better than building a real estate or something.
The returns will be better, not might. So let's start. We have started, and it's a shame that it's taken COVID to bring it out.
You think COVID will be the changing point?
COVID would have to be the game changer. Yeah. I mean, there is nobody more than 40 years old or even 35 who is in the medical community who has seen COVID and who will go back to work and the good Lord will forgive him or her. No, because this is an existential threat. It's a living or dying threat. Now, for all of us who have been the beneficiaries of the largesse of Ghana, global agencies, you are seeing a threat. You have solutions. This evening, I've been to the university doing the ventilators, and I've been just blown away. And as you look around, they are Ghanaians. So what is needed is the private sector. I don't think personally that this is a job for government to be putting us together. The president has laid down the law and said that meet each other and be self-sufficient. My take, and I have said this way back in August 2019, that scientists in Ghana should go to government and their government, that we will solve this problem. This is what it takes. Challenge us. Because if you're in policy, you also cannot just take a decision because Alex Dodo or anybody said it. It's about time our scientists and our businessmen also say, look, you have traffic problem, we can solve it. This is what it takes. Because we must sign up to the interventions we bring. Why should the politicians be the only one who get bashed when things go wrong, when all of us were paid for by government?
There's this song, and I've forgotten the person who sang that, said we want to go to heaven, but nobody wants to die.
Bob Marley.
There is also an issue in times when it comes to vaccine development, the trials and the moral issues and all the rest. And we want the vaccines, but don't bring it to my house.
Okay, during the Ebola crisis, some very good friends of mine in government said they should try the vaccines on me. Here's our take. In Ghana, and I am signing up to it because I'm on record, we have developed the principles which apply anywhere in the world, that the welfare of a participant in the trial is more important than any other thing. So human beings are protected. That is why Ghana is the first country to have given the malaria vaccine to someone, and the results are astonishing. Now, when you come to what we have done, or where I see a weakness, state actors, I say GSA, FDA, all of us in the past have never engaged the private sector as partners. Because you see, if the private sector sees you as a policeman, look, everybody seeing a policeman wants to run away, even when you are not innocent. But when the private sector sees that you are a facilitator, as we are doing now, and indeed we did that for Ebola, Ghana did that, other countries did that, because what is going to happen is that the private sector man has his money. Academia can develop something, but the regulator should say that, look, we are hand-holding, because we are in uncharted territories. Case in point, the Food and Drugs Authority of Ghana said, look, people want nose mask. The Minister for Trade and the Minister for Health said, you guys do something. Myself and FDA, we said, look, we can test the fabrics, but we are not good at the porosity and all the funny things about nose mask. FDA said, oh, we have a machine. Now we have a specification. It's global, it's world-class, it will move. But I think we need to have two things. And I know you would understand because you're a finance man. George, the private sector exists to make a profit. And that is a divine right that we must not deny them.
Let me bring in Senor Jose, who is joining us via Skype. He's the chief executive of the Bulk Oil Chamber Distributors, and he's also actually leading a group of CEO, the private sector fund for the COVID-19. Is it all about the bottom line, the profit? So if I come to you and make you a proposal and listen, you're not giving me any good returns on these vaccines and all the rest, George, go and sleep.
No, business has to do with some profits, but it has more to do with meeting a needs, meeting needs profitably and sustainably. If I'm going to have to meet needs in a way that's not sustainable, I can't keep being of value to you. So the question, what will it take for private sector to be able to deliver value sustainably? Of course, there has to be a market. Of course, there has to be an enabling environment. Of course, there has to be a margin in. Because from the margins that you pay your employees, you actually pay returns back to the bank and also to your shareholders. Else, nothing makes sense. What you find in other jurisdictions is that the biggest heavy lifting is the research part. Breaking that into granular economic opportunities. So people with capital can drive capital to boost and drive particular industries. I am not a chemist. I am not a pharmacist. I can understand how to manage processes. I can understand how to put together businesses sustainably. But I need to figure out what the opportunity is. One of the problems we have, and I think Prof really indicated that, is the fact that most of our professionals just get too caught up in they being professors and doctors and they having published X and Y. I tell people, publishing something in a journal that the very broader society is going to be less bothered about and you're not translating it in something meaningful to him, it's not so great an achievement. So all these things, researches that are done, how do we translate them into investment opportunities so that people like you, myself, can ask, okay, if I put $1 here, possibly I could get $1.50. If I borrow from the bank and I have to pay the bank 30, I'll get $1.50, pay 30, keep 20, pay my staff, and probably keep a little return. Other than that, what's the point? And Prof, you're right. I don't think vaccines are going to come from Ghana anytime soon. We need to set our priorities right. And I think that the president was really right when he was saying that this is quite a wake-up call and we'll have to start thinking of how to be self-sufficient. It needs a lot of government and policy efficiency. We need to be effective and deliberate in our policy making to actually grow Ghanaian businesses and Ghanaian opportunities. I think that it should be possible that our scientists would have broken down opportunities so that I know that this is the kind of fabric that is required, that all our research hubs should also have business development units attached to it, so people can actually break down the researches that are done into business opportunities. And that's one of the challenges I have with my universities. Our universities are publishing. Nobody is hearing anything, but we have communication units. We have business departments. Who is translating that into opportunities for people to invest in and create employment? Yes, they will come back and complain about challenges with employment. It's just the reason being that capital is not effectively appreciating opportunity or de-risking it. Government must also sometimes lead the charge with research and breaking this down. I mean, comparatively, I'll just give an example. Somebody like one of the Petroleum Commission has taken some initiative in that regard. They have set up a business development desk. So if you don't want to get into that business, you should want to go there and they can tell you these may be the opportunities, not in very broad terms only, but in granular terms. And you can have some relationship with opportunities and returns and what you may require. We don't see that from our scientists. Not at all.
So I'll come back.
So these things so they can be more meaningful to capital. And capital meeting opportunity, adding labor, would only lead to economic development.
So I'll come back to you. Don't go away because I have more questions for private sector, which I think you'll be answering for me. But Prof. Alex Dodo, I mean, let me ask you one thing. You still work in the pharmacology industry, serving on several boards and all those things. In economics, they'll say all other things being equal. Do you see a COVID-19 vaccine being developed this year? Because someone said that, listen, I was talking to someone today, said that, George, listen, forget about the economy being turned around. Forget about these lockdowns ending. Because in UK, we understand they're going to extend it for 3 weeks.
Yeah.
If there isn't a vaccine today, the economies won't pick up. Everybody will still be locked down in their house. Do you foresee a vaccine this year?
Yes, yes. I mean, there are already
a tried and tested vaccine.
Okay, there are already vaccines, and I am serving on one committee looking at the safety of a vaccine, and that's as far as I can say. Let's face it, safety is number one. And currently, most of the vaccines we have, shall we say, we are evaluating the safety without saying too much. So there are vaccines. There are at least 8 candidate vaccines. There are at least 8 candidate
Prof,
vaccines.
again, just within the shortest possible, if you can quickly run me through. So
there are at least 8 vaccines in different laboratories. These are being evaluated. 1 or 2 have started in human trials. The issue is that you want to be sure that they are safe.
Are they in Ghana?
No, none in Ghana.
Okay.
None in Ghana. We want to be sure that they are safe. And then when you look at their safety, unfortunately, it's more complex. Are they safe on their own? Are they safe when you add other vaccines? Are they safe under all conditions of use? And who do you give them to? So we are at that stage. Within the next 3 weeks, we should be able to conclusively say which ones will go further, better. But then society would have to make a call. That is the scientific community. It's going to be the benefits versus the risk, because number one is lives versus livelihoods. But beyond a certain time, just like we are saying in Nigeria, 18 dead by police, and we would have to make a way in between the two.
In finalizing some of these vaccines, is it the money or your rigid protocols? Because I know that, and I know the medical community and the standard practice that even the doctors, sometimes they have to go out of their way and let's see whether this will work. Is the money the problem or the protocols that you have to go through because of the human safety things? And I'll come back to you on another question. I remember I once was prescribed a drug, and I tried to read a lot, the medical journals and all those things and all the rest. And the prescription, the one on the drug said that I'll get a seizure, I might end up going off, I'll have a running tummy, and all that. And when I read that for the first time, the drug was worth about 700 Ghana cedis. I told myself, I won't take this drug. Why do you have to put up all those? Is it for the legal reasons? But first, let's look at the first one first.
I think the first one is right. I mean, we will get a vaccine this year. Why? Is it the protocols are rigid? Let me answer it in a very Ghanaian way. In the 20th and 21st century, asking the sweetest too much. That is the reality. Yeah, because, our tolerance level for harm is very little. And the doctor, the scientist who prescribes the medicine that will cure you today, in 5 years' time, you sue the one because he caused your hair to go from black to slightly black. And these are the issues we are dealing with. After the Ebola, listen, people were trying to sue the companies for giving them vaccines which gave them other issues. There is no risk. There's no benefit without risk. So as you have medicines, they will have their benefits, they will have their risk. We live in a very libertarian society at the moment. And very soon, all governments would have to accept that there has to be a measurable level of risk with the benefits we expect from medical intervention.
Prof, let me quickly bring in Dr. Boaji, who is the Director General of the Ghana Health Service. And in terms of moving on, Doc, what would change when it comes to the Ghana Health Service and medical research, vaccines, and moving on, getting on board the private sector. Would anything change? Or 10 years again, if I'm here, we'll sit down here and talk about the same problem, Doc?
Thank you very much. We appreciate that this is definitely not going to be the last outbreak or pandemic we're going to have. Mm-hmm. And as we have already been talking, this is about not only responding to the condition, but also building our capacity and our resilience to be able to fight the next outbreak. And that means that working with all our partners, ensuring that standards are maintained, and that's what I'm sure Prof has told you about, that these are all that will secure us from skills and making sure the quality of care is improved.
It looks like we're having some challenges. With, go ahead, Doc, sorry.
Look, this opportunity has also given an opportunity to get closer, give us better working relations to our partners, especially in the private sector, to be able to do that. And I must say that they've responded very, very appropriately and promptly to some of the challenges that we face. The initial phases, within a week, we have about 17 companies producing sanitizers for us to be able to use. Yes, but I just joined late, but I heard you talking about vaccines. That's the way out. And I believe that we will need to work with them. They need to get governmental support to build their capacity for private sector. Also, not only a country becomes just a place where people try their vaccines, but also a place where vaccines can be produced and tried here or other places. So we believe that's a good opportunity. I mean, it's a cost-benefit analysis. There's been a cost, but the benefit has been that we are probably working more together now, and everybody has responded to this request, and I believe that we'll be able to support and build our systems better for the next epidemic or pandemic, whatever it is.
Doc, I don't know whether 10 years' time you might still be in the private sector or a consultant, but I'll come back to you on this promise that you've given to me in terms of the collaboration. But final one, Doc, being in the health service as well, have you been surprised by the response of the private sector? I'm seeing the real Ghanaian hospitality in terms of companies signing checks. I know people who, listen, George, took off work, and Sonyo is one of those people, going out there, raise money, cook food. Listen, somebody said, George, I want to do something for the medical doctors. Talk to them. Are you seeing the other side of Ghanaians and businesses responding now quickly to help the medical field?
Yes, I think as a Ghanaian, I will not say I wasn't surprised, but I moved from surprise to a shock as the response that they have come up with. So as a Ghanaian, new Ghanaian hospitality is there, but I think they've gone beyond the normal Ghanaian practice, and we are very appreciative of what they have done. Some of the things they have offered is incredible, and especially when the lockdown actually affects their business and reduces their earnings, and yet they were able to come up to support so much. And I think we want to really thank them.
Doc, I said the last question, but this is the last question as well. and these are people that I'm very, very passionate about, my friends who are in the health sector. Again, and the friends doctors, what are we also doing to improve their condition of service? That is very critical, Doc.
I didn't get a question. You mean health?
I'm saying that health workers, medical doctors, nurses, what is being done, I mean, to improve their conditions of service for them?
Well, I believe that DMA, GRNA, everybody knows that in the last few months, there's been some ways of improving the care. I mean, the working environment is not just about the wages, but also the kind of environment you're working. So in this response, getting PPE is important. The government has worked very hard to get the private sector again to come in to produce PPE. in appreciation.
Sorry, the line broke there, but Dr. Patrick Aboagye is the Director General of the Ghana Health Service. And if you just joined us, this is the business edition of PM Express. I would mean in studio Professor Alex Dodu. He's the Director General of the Ghana Standard Boards, but he's here also in his capacity as a clinical pharmacologist. That's where we are. We have so much interest. Senyor Hosi is the Chief Executive of the Chamber of Bulk Distribution Company, but he's also leading a team of chief executives that are actually champion or set up a fund to help fight the COVID-19. We'll take a quick commercial break and we'll be right back. But he's also leading. Welcome back to the business edition of PM Express, and tonight we're looking at medical research and vaccine development. What role can the private sector play? We've talked to a lot of people in the industry. Senyor Hosi is the Chief Executive of the Bulk Oil Chamber Distribution, but he's leading a team of CEOs that have set up a fund to help support the COVID-19. In studio is the Director General of the Ghana Standard Boards, Professor Alex Dodu, but he is a clinical pharmacologist, several boards that are into vaccine development, but he's still serving on boards, actually. Prof, let me come back to you and also bring the concern about regulation as well. And when you speak to some of these pharmaceutical companies, you speak to the private sector, they put the blame at your end. You guys are too rigid. You have played in the private sector. You appreciate the challenges. Are things going to change in terms of standardization, fast-tracking the process, being more private sector friendly?
The answer is yes to all three, and I can give you the facts. I can't mention individual companies. Yeah. Yesterday, I was at the Food and Drugs Authority as a board member to have a meeting with a particular product and the manufacturer with issues, and we resolved it in a way which is best in the national interest. Yesterday, the Ghana Standards, no, that was 2 days ago. Yesterday, the Ghana Standards Authority certified the first solar hand washing machine for free by supporting the developer and also giving ideas for further development. I would admit that for years, the government side, I would say the state side, has appeared as if it's a policeman or woman over the private sector. But that has changed. In 2012, I was chairing the Global Vaccine Safety Initiative. That was when the swine flu H1N1 came about. What the whole world realized was that industry makes the products, and they are the smartest in making products. Governments need the products, but government needs to protect its people. So we all sat down and shared information and moved forward. I think that was a seminal change because we realized that we have the same interest, the welfare of people. The private sector must make money so that he or she is sustainable in their business, as Senyor said. Government has to protect the population by, one, keeping them safe, but if you do not provide the needed vaccines or medicines to your population, you are not keeping them safe. Let me bring in Senyor in quickly and I'll come back to you as we try to wrap up. So, Mr. Hosi, for you, private sector, moving on, what do you want? And I've asked you this question so that this would not be just a one-off thing, but we are all opening a new page when it comes to vaccine development, medical research, and the private sector.
I think that what the GHS boss, Dr. Aboagye, said was important, acknowledging the relevance or the impact or contribution of the private sector in these crises. My question is, how assured are these producers of the market going forward? When things get back to normal, are we suddenly going to remember our Chinese suppliers and Indian suppliers and forget those who have been there for us in crises like this? It's a big question that I think will be great having government issue a major statement on. There have been very accomplished businessmen who have actually invested in chains of fabric, clothing factories, and they had to shut down because some basic incentives were not there. Reliability of power, reasonable pricing of power. You charge industries higher than you charge households. And how do you expect industry to be competitive and make sure the households are employed? Nobody answers that question. But you have the reverse in these countries that we are importing the products from. How do we effectively compete? So I think there's a need for a holistic look at the situation. I appreciate the fact that the private sector did not sleep. They woke up to the calling, and appreciate the fact that they were Ghanaians and they had to really pursue the interests of their country foremost. How do we grow more of our businesses? So that real discussion and getting private sector on the table of policy must be had. And I think the private sector must also change its orientation. The very average Ghanaian big businessman is so patronage oriented. So trying to face with policymakers and trying to shape policy is not something, it's something they easily shy away from. Thinking of how not to hurt something, no. All those things must change because we have a bigger stake in this economy than any politician.
Okay.
And the politicians need us to help them shape policy well enough to protect and thrive the economy. So people must open up, the politicians should also open up the space for proper engagement and proper joint strategy and realize that those who have stepped up today, there's a need for them to be remembered going into the future, especially those in the pharmaceutical industry who have actually stepped up to the plate.
Senor, I thank you so much for your time, and also be looking forward to that 100-bed infectious facility that you'll be putting up, the COVID-19 private sector fund. Thumbs up to you and the other CEOs doing all these work to make sure that we are safe. Thank you so much, Senor. Let me come back to Prof. And putting on the pharmacology hat, do you think that we've learned our lessons and that we will be well prepared for another pandemic?
We will have to, because we have to for one reason. The certainty is that there will be several pandemics in the next few years. Indeed.
Worse than this?
Absolutely. You have to prepare for that. So let me just make 2 or 3 brief points. One, I'm pleased that for once, Senor and myself are on the program without any controversy, which will lead to Senor being in trouble. But Senor said he had a business development unit. We do have one at the Standards Authority. Okay. Now let me come to the issues. Why would there be? Why would business have to change? A few years ago, I happened to be serving on the group called the Market Dynamics Advisory Group. And what were we doing on the Market Dynamics Advisory Group? We were looking at, if someone is going to produce a product where he or she is not sure that there will be benefits, they won't produce it. So at the UN level, we started saying that if a child has tuberculosis, there are only few children. Why don't we play the market by giving assured business to the developer? That if you develop your product, we are buying 100 million doses, regardless of who needs it. It's called market dynamics. Because businessmen want their money. We've done that for malaria. That's why we had this AM, FM, and all of that thing. So we need to bring economics and social sciences into healthcare because businessmen want their money. Let's do market dynamics. Let's Ghana assure the companies in Ghana that we are going to produce 200 million doses of X in the next 20 years. And people will put their investment there. So that is some of the policy interventions that we have to drill down on. Will things change? Things have to change.
I like the bit about saying things would have to change, but again, getting you back into the science area again, you've worked in these epidemics, being a pharmacologist and all the rest. Let's even look at in Ghana. Do you see the curve coming down in terms of the COVID-19 thing, or listen, things could expand a little bit before it gets normal?
From my personal side, my estimate would have been a higher level of infections than now. So we have much, much less than I personally expected. And I'm very pleased about that. And we want to thank the authorities, the president and the team and everyone for having helped us. But we cannot be complacent. Where we are now, 5 weeks into it, mortality is 8. It's been virtually flat. It's touch and go.
Would you call for an extra lockdown? More lockdown? UK is doing 3 weeks now, extra 2 weeks.
Let's put it this way. As an appointee of His Excellency the President, I will defer to him, but I will say this.
What will you advise the President to do? Putting on your medical hat. My medical hat, that we should hasten slowly. I would not think that Ghana's best interest will be served immediately by locking down, but whether it's going to be 1 extra week, 2 extra week, 1 extra day, we would have to kindly hint our boss on the way forward. But I think the advice is still the same. Much as Ghana hasn't witnessed the worst can be around the corner.
So we use a phrase called ETW, expecting the worst. If we are expecting the worst, which could be 10,000 cases, what do we have to do? We are blessed. Mortality is very low. 8 out of 600 is extremely low. It can remain that way. It can remain that way if we all work together to stop it. And George, I think we have done well, but I don't think we should be congratulating ourselves yet. When all this is over and we have started producing the vaccines and the medicines we need.
Would Ghana be a beneficiary of the vaccine if it comes out this year? And you said it's going to come out this year.
It's going to come out this year, and it's going to be ability to pay, because if there's a demand for vaccines,
can we pay for it?
We can afford. We can find the money. We can find the money. But George, I would like to state this, and I've said this even in Parliament recently, that the future of Ghanaians, we have too many Ghanaian experts for us to leave vaccine production, drug production, and other production to any other hands. I can list in the pharma sector alone, I can list about 20 Ghanaians, including myself and others, including Prof. William Ampofu, who are producing for the world.
Okay.
We
have them here.
Oh, they are Ghanaians.
Okay, sorry. I don't know whether we should have a part 2 of this, but we'll look how things will pan out. But immense thanks to Professor Alex Dodu. He's the Director General of the Ghana Standard Boards, but also served on several UN, WHO boards when it comes to vaccine development. Well, all too soon we have to draw the curtain down, looking at vaccine research, medical research, and vaccine development. This has been the business edition of PM Express. Maybe we'll be looking forward to a part 2 of this, I would say. Enjoy it. I know the debate will still be going on in your homes, in your hospitals, and your labs, and at the Noguchi centers and all the rest. Have a great day. My name has been George Afe, and I know that this shall pass.